It's the 21st day in the month of September, the year 2023. Another very, very good day, I must tell you, from our studio here, IKD 106.1 FM. Another good Thursday to talk about healthy conversations, I must tell you. Another very beautiful Thursday where we'll learn again. But this time around, I think all parents out there listening needs to be a part of this conversation as we tend to talk about the myths of child care needs of childcare, which is so important and germane to every parent out there, especially mothers. This is a conversation that you should be a part of on the issues here at IKD 106.1 FM. I welcome you. I'll be your host for today, and I have my guest in the studio who would also be doing justice to the conversation. She happens to be a doctor from the pediatric department, General Hospital Ikorodu, in person of Dr. Abiola Ademolu. Together, we would have this conversation on needs of childcare. Now, when we talk about the needs of childcare, there are some ideas, there are some beliefs in the minds of parents, especially parents that tend to have grown or they learned from their own parents. These are some of this tradition, these ideas, they pass it on to their own children, and then gradually the abnormal is becoming normal in our society. All of these and more we will discuss today on the needs of childcare. So again, I say to every parent out there that has a child that intends having children someday, please be a part of this conversation. You can also join this conversation from anywhere all over the world. All you need to do is watch us live on Facebook as we stream live on Facebook. That is IKD 106.1 FM. IKD 106.1 FM. You can also join the conversation via audio. That is on our website www.ikd1061fm. My name is Opeyemi Adiba, but when I return, we talk about the needs of childcare with my guest, Dr. Abiola. Good morning, Lagos. Still the issues on IKD 106.1 FM, talking about the needs of childbearing. I should let you know that it is the joy of every parent, to see their children, their kids, grow healthy. If you are a parent and you want to grow healthy, it is also important for you to know that there are ways at which you care for your child to ensure that your child would also grow healthy, strong, and healthy. With me in the studio is Dr. Abiola, like I said, from the Pediatric Department, General Hospital Ikorodu. Good morning to you, Doctor.
Good morning to my producer. I'm happy to be here. Thanks for inviting us.
Thank you very much for joining us, Dr. Abiola. Together we will have this conversation, talk about the needs of childcare. But the first thing I want us to talk about is when we talk about childcare in itself, what is childcare? How do you define childcare as a doctor?
Thanks for the question. So, a child, actually, when you talk about a child,
Yes.
it depends on, it falls into different age groups.
Okay.
From when the child is born,
Mm.
and to us as pediatricians, we use the maximum age of 12.
Mm.
Now, if a child is born today,
Okay.
for the first 28 days, that child is referred to as a neonate.
For the first
28 days of life.
Mm.
That child, though a child, but specifically, we call the baby a neonate. First 28 days of life.
Mm.
Then, from the first 1 month to 12 months, the child is an infant.
Okay.
Between 1 year and 3 years, we refer to the child as being a toddler.
A toddler.
Between
okay.
years, after a year to 3 years, the toddler,
Mm.
and thereafter, childhood begins.
Mm.
Yes.
So all of these stages require different forms of care.
Yes.
And that is what we can define as child care.
Yes.
Fantastic,
Exactly.
fantastic. Thank you very much. Now, for clarity's sake, all of these stages that you have mentioned correctly, is it something for just the mothers when we say child care? Is it something that entails just the mother's responsibility, or it is something that works alongside with the father as well?
Yes. The whole totality of the well-being of children or a child, it's not just limited to the family life.
Okay.
Because as you know, once a child is born, yes, the first few months, probably a year, the child is at home, basically with the mother, who is usually the caregiver, or probably being taken care of by a nanny. And because mothers have to work.
Definitely.
So those children or babies, some of them are put in the custody off a daycare facility, or some actually employ nannies or caregivers into their homes to take care of the children. So, talking about the care that will be given to a child is really not just talking about the family care. It goes outside of that.
It goes
So
beyond
it
that.
goes beyond that. Yes.
You know, now when you talk about some parents would actually employ the services of a nanny and all that,
Yes.
we see these things on a regular. It happens.
Yes.
When exactly is the right time for a parent to say, okay, I want to take my child to the nanny? We know of a child that is born 1 month, 2 months, and then the child is already with a nanny being taken care of. And then we know and we hear that originally a child should be properly breastfeeded for some particular time. So I would ask you now that what is the right time, the right stage for a parent to take their child to a nanny or employ a nanny to take care of their child?
Well, thanks for the question. I want to first of all appreciate or express our gratitude to the Lagos State government.
Okay.
Presently, years back, maternity leave has been extended to 6 months. Yes, and in fact, now fathers also are also enjoying what we call paternity leave. Now, presently, a father is given 2 weeks after his baby is delivered to also, help and support the wife,
The wife.
to nurse the baby. So ideally, within 6 months, a baby is expected to have what we call exclusive breastfeeding. So the baby is meant to be exclusive breastfed for 6 months. Thereafter, the mother can now resume work. So after 6 months, that's when we say the baby moves on. In addition to being breastfed,
Okay.
the mother introduces the baby to complementary feeds. So I would say by the age of 6 months, the baby is good to either be put in a daycare center which the mother can vouch for,
Okay.
and then of course go to her work, then come back, continue to breastfeed in addition to the complementary feeds.
So this is to say that for parents that takes their children to nannies, or employ a nanny, are you saying it is not right for parents that don't even wait for 6 months?
Well, I can't really put a rubber stamp on the actual age for some parents because,
Okay.
as we know, the work schedule is different. I've been a government worker now, assuming I'm the first time, of course, I will enjoy the 6 months. But this is not applicable to somebody who works in some other organizations.
Very true.
So it's a flexible thing, you understand? But the truth is, whosoever you are leaving your child in care of, you must have made some, underground
Check.
investigations and checks just to be sure your child is in good hands.
If you're joining us today, I can tell you for a fact that the conversation will get better while we talk about the myths of childcare. Some of these beliefs, some of these ideas as parents that we have in our minds, and we are training our children in that manner. Some of them are wrong. I'm not saying all. These and many more we will talk about today on the issues. You can, of course, be a part of this conversation. If you have questions whatsoever, you can send us WhatsApp messages or text messages to our studio line 0904 082 1061. That is 0904 082 1061. And of course, you can also call into the studio lines to ask us questions. My doctor, Dr. Abiola, will be here to do justice to your questions on 0904 081 1061, 0904 081 1061, or 0904 082 1061. Talking about the needs of child care, Dr. Abiola. Now, the question I want to ask next is there a particular way at which parents ought to care for their child? Is there a particular standard or measures at which a parent can say, okay, this is how best I am supposed to do it? For instance, the Yoruba tribe will tell you that when the child is just a month, there's a particular thing you do to the child. If he's a boy, if he's a girl, you do this one, you use this, you use that. In the medical line as well, are there doctrines, are there ways, pattern at which you could care for a child?
Thanks for that question. In childcare, we must remember that the child actually originates from a family. And we know that in this part of the nation, Nigeria, and of course some other countries, we have some cultures and beliefs.
Mm.
But we found out that, yes, some cultures cannot be separated from the upbringing of a child.
Mm.
But suffice it to say that those cultural beliefs that are not at loggerheads with basic medical practices could be upheld.
Mm.
But in practice, generally, we found out that there are so many cultural beliefs or practices that go against the health
Mm.
or eventually lead to some degree of damage and, in fact, demise
Mm.
or loss of lives at different age groups. Don't forget, as I said at the beginning of this lecture, that when you talk of a child, it depends on the age, for
Mm.
right from birth up to the age of 12 or 14 years, as the case may be.
Mm.
So, I want to say, yes, there are some harmful cultural practices or beliefs. I'm sure in the course of this conversation, we
Yes.
just have to be specific as per mentioning.
Yes, we'll definitely
Yes.
get there. We will
So,
definitely get there.
so that's
Mm,
to
okay,
answer the
so
question.
there are no major or particular ways, so to say that okay, this is what you should be doing. You know, you mentioned about three categories the other time, saying that there is a stage. From this stage, we progress to another stage. So of all of these stages, there are no major medical ways at which we could train a child.
Now, it's not really about medical ways of training a child,
Okay.
but practices now I think I just have to be specific now.
Mm,
Coming down to the time of delivery,
mm,
we found out that some babies, after they are born, in those olden days,
mm.
after babies are given birth to, our good grandmas, they are usually, of course, everybody's happy that a baby is going to come
The
into
excitement is
their
always
time.
there.
The joy is there, and I
Yes.
tell you, our very wonderful grandmas, they are ready to do
Mm,
their work.
mm.
And from experience, and of course in the practice too, we found out that some babies, they have this massaging of their bodies done. In fact, there was a video that went online. I'm sure probably you also saw it. That a woman was holding a baby on her laps, extending the arms
Oh yes.
almost
Oh
to,
yes. Oh
you know,
yes.
is it 180 degrees? Ha! The baby, in fact, almost, flexing and bending.
Hmm.
If that baby does or did not escape the bones being fractured, it would be a miracle.
Hmm.
So those are the initial things some of our grandmas do.
Hmm.
Though they have good intention, but I tell you, babies don't need that when they are born. Babies, when they are usually born, they have good tone, good posture.
Hmm.
For
Hmm.
those that do well, they cry at birth. So all those things, they are not needful. Another thing we found out that is that when those babies are born, of course, questions will come in. I have to be more specific.
Definitely.
Some would say the baby has an oka. Sorry for those of us who don't understand the Yoruba language. The oka is the anterior fontanelle. That area in front, just in front of the baby's head, that is usually soft and a little bit depressed.
Hmm.
Yes, that fontanelle, we call it anterior fontanelle, is a normal thing in the head of a newborn baby.
Hmm.
But in practice, you know, some will say it's oka, and for them, the baby must be put on, oral concussion to block. And the danger of somehow blocking, so to say, using their own language,
Yes.
the place will lead to what we call cradiosynostosis. You understand? Once that place, see, the way um, nature or God has made that place is that once that fontanelle is open, it helps the baby's brain to grow. You can imagine, producer, the size of your head if you were born as a baby and you're still maintaining that head size with this your big stature, it doesn't fit. But the way nature has made it is that, and as the baby grows, it grows little by little. We know the dimensions until the right age at which it closes. Do you understand? But if that place is made to, this their agbo, oka and all that,
Yes.
you understand, there'll be some degree of mental retardation, small head, what we call microcephaly, and of course, the baby would not do well in terms of cognition, that's in terms of academic performance.
Thank you very much, Doctor. Still talking about the needs of childcare. Now, when we look at childcare in itself as a word, some persons might want to ask, what is the importance of childcare? What is the essence of childcare? Because while I was speaking during the introductory speech, some persons are already used to the traditional way, our culture, our tradition, which we are not discarding anyways. You know, they will just tell you that this is how they trained me. This is how my mother did for me. I would also do same for my child. Now tell me, doctor, how important is this medical child care that we are talking about? How is it very important for us to go through the right channel, so to say, rather than just follow these myths that sometimes are not even helping the children, just like the way you have said? Why is it important for us to go through this child care?
Childcare, as we said, there are various things that should be put in place depending on the age.
Mm,
As you rightly said, I remember sometimes ago we had a baby that was brought to the hospital. The baby had neonatal jaundice.
mm,
Yes. And I think the baby died, if I'm not wrong.
mm,
It happened some years ago. And I remember the grandma came and she made a statement, said, this, the way I treated this child was the same way I treated the father when he was young,
mm,
you know. So, but, medically speaking, if the child, if the father had had jaundice then, probably it was a physiological one,
mm,
that somehow, whatever, regardless of your intervention, is going to clear, and it's not going to cause any harm to the baby. But obviously, this baby that was brought in and eventually died had pathological form of jaundice, which the purple water or whatever intervention the grandma gave the father then could not resolve, which unfortunately led to the demise of the baby. So what we're saying in essence is that yes, there are some cultural practices that we cannot totally abolish. The ones that are good, yes, we may, yes, allow that, but we find that most of them are inimical, harmful to these babies, and those are the things we've come to address in this program.
one of the very important conversations we'll look at is breastfeeding, which is very very important. Tell us about breastfeeding. Some will say it is 3 months, some will say it is 6 months, some will tell you that it is not even very important if you have money for the proper what's it called? What do they call the names of this food and all that? They tell you it's not important. Let's talk about breastfeeding exclusively now.
Now, good. As I said initially, that breastfeeding is very, very important. It's the baby's first meal or first milk. Very, very important. It's safe, it's harmless, readily available, in the right room temperature. You don't need to do any preparation. So it is said or advocated by the Pediatric Association of Nigeria that babies should be breastfed for the first 6 months of life, and that's what we call exclusive breastfeeding. By doing that, there'll be no water, there'll be no agbo. So exclusive breastfeeding simply means that baby is born today, and for the first 6 months, what all the baby takes is breast milk. And I tell you, some mothers feel, how can a baby survive without water? The quantity of breast milk itself, about 87% of breast milk is water. Do you understand? The other constituents, of course, the many carbohydrate, protein, minerals that are helpful to the baby's development. So, yes, breast milk, there is no negotiable. Yes, for the baby. Now, we know that some mothers, when they resume work, as I said earlier, not all of them have the privilege of having 6 months as maternity leave. And of course, some after 2 months, 3 months, they have to go to work. But that does not say the baby cannot still be exclusively breastfed, because such mothers, they can express their breast milk and keep either in the fridge or on a table in a good container. You understand? So such breast milk can equally be expressed, put in the fridge on a table, and the baby can be fed with that. And we know that there are some conditions that may warrant the baby to have alternatives, what we call breast milk substitutes. For example, the loss of a mother. Sorry to say, some mothers during the process of delivery, they give up for one reason or the other. Yes, culturally, there's something they call surrogate mothers. Yeah. it's allowed in some parts of the world. Of course, that is not culturally acceptable, may not be culturally acceptable in this part of the world. So for such surrogate mothers, their grandmas, or probably an elder, an auntie can come in to breastfeed such babies. Of course, that's when, medically the so-called surrogate mother has been screened against some infections and all that. But culturally, in this part of the world, it's not really acceptable. So such babies that lose their mother, or for some reason, probably the mother has psychosis, extreme and all that, can't.
When we say that breastfeeding, and you've taken your time to explain that, another side at which I want us to look at, I have heard of stories where a mother will tell you that for one reason or the other, I can't breastfeed. You mentioned the fact that except maybe there's a loss of a mother. Are there any other medical? I was not opportune then. I can't really recall. I was not opportune to ask, why can't you breastfeed your child? Are there medical reasons to which a mother would say that I can't breastfeed my child right now? Are there any complications or issues, so to say, that would warrant a mother saying I can't breastfeed my child for now?
Is it health related?
Yes,
Okay,
please.
yeah. We've mentioned a very important one, so to say, a mother who gave up or who lost her life. There's a medical condition called galactosemia. You understand? The babies also may not be able to take their mother's breast milk. That one is due to an enzyme deficiency, somehow. Yes. In diseases, sorry, because I know it may be on your mind, retroviral infection, HIV, the mothers are allowed to breastfeed, but under certain conditions. So nothing stops an HIV positive woman not to breastfeed a baby. But of course, during antenatal care, the pros and cons would have been explained to this mother. You understand? Of course, if she's able to abide by the rules, she can go ahead and breastfeed the child.
Okay, so now let's talk about another one, still in line with child care. One very common disease is this one that is called jaundice. Most of the times we have a child and then we hear jaundice. It has gotten so bad that some will even tell you that start preparing, very soon now. Jaundice will come for this child. What is the cause of this jaundice and how best can we even prevent this jaundice? It affects almost every child. It has gotten so bad, like I said, that they will tell you that your child will have jaundice.
Thanks for that question.
Yes.
Now, jaundice is a common illness or morbidity in babies. It is said that about 80% of term babies, that's babies who are born at 9 months, that's 37 completed weeks, who have jaundice. Sorry, 60%. And for preterm babies, about 80%. So that means the risk is actually higher in preterm babies. 80% for preterm, 60% for term babies. Now, as I've said, that means 6 in 10 for term babies, 8 in 10 for preterm babies. That's premature. That's your own language.
Yes.
Would come down with jaundice. Now, there are two types of jaundice. There's a physiological one. That one is the one that, as I told you earlier on, even if you don't do anything, it's going to go through its natural course and is harmless. But medically speaking, the physiological one is a diagnosis of exclusion. You understand? It's a retrospective diagnosis. That means you must have said, oh, you've done this test, the jaundice is not due to this. You've done this test, it's not due to this. You've done all your barrage of investigations, the jaundice is not due to this. That is when you can safely say this child has physiological jaundice. It's the harmless one in quotes. Now, there's the pathological one, and that is the one that we are always weary of as doctors or pediatricians. Do you understand? And that's the one that eventually, if it's not well addressed and on time, leads to brain damage, and of course the babies come down eventually, like with mental retardation, and of course some of them do die. Still talking about jaundice, that is why for us at General Hospital Ikorodu, we advocate that once our babies are born, in fact there's a doctor that's assigned to go to the delivery room every day, checking the babies, looking at their heights, yes, checking, is this child jaundice? And once it is noticed, we take the blood samples, sent to the lab for analysis. And of course, if it comes out to be, of a particular value, we commence treatment. Do you understand?
Yes.
But for the pathologic one, that one needs to be addressed and promptly too. And that is where the mistake of some of our mothers come in. As I said, they may not know which one is physiologic. I told you of the experience of a grandma that said, but this is what I did to the father. And meanwhile, unfortunately, this same baby, the grandchild, died. So, unfortunately, some of our parents, they don't know the demarcation between the physiological and then the bad one, which is the pathological. So they think it's the same method of giving ampiclos, and that's what some of the practices they do outside there. A baby is born, in fact, before the baby is born, they're already ready for some of them with the ampiclos to treat jaundice. Some, when the baby is born, we get all this information and we see from others the use of purple water. Some instill breast milk into the baby's eyes. Some put the babies in early morning sun. You understand? This treatment will never work for pathologic jaundice. And the pathologic jaundice is a dangerous one.
Thank you very much for that clarification. I felt that was necessary because, jaundice is one very common disease that affects a lot of children, and it has gotten so bad that every child, every parent rather, tends to prepare for it, whether it comes or not. When exactly, from all of these categories, does this cerebral palsy comes in? What is the cause for this one? Jaundice is even easy to relate to it or deal with, so to say. But cerebral palsy is one thing on its own. Can you shed more light on this?
Yeah, thanks for that question. Now, I have to bring it back to the basis. Now, cerebral palsy doesn't just come on. It's as a result of what happened during the birth process. Yes, let me try to break down my English. Now, there are various causes of cerebral palsy. Now, as I said, about 70% is idiopathic. You can't actually tie it down to a cause. That's what you mean by idiopathic. But one of the main causes in this environment is what we call severe perinatal asphyxia. I'll break down that in English.
Please do.
Now, we found out that, sorry to say, many of the babies being born in Ikorodu, or quite a number of them, they are born at traditional birth attendance places, some of them in churches, some at home, and some even in some hospitals. Now, they are born, they don't cry. As a gynecologist said, it is what the process they start. Gynecologists are doctors that take care of pregnant women and all that. The process they start is what they give us as pediatricians to manage. Okay. So that means during antenatal, if a woman is not, women at risk of developing complications, if they are not identified or they don't have good antenatal care, their problems are not picked up at during antenatal visits, you can, of course, expect that for some of them, they're going to have difficult deliveries. I hope you understand that.
Yes.
And when those babies are born, some of them, they do not cry. What I mean by severe perinatal asphyxia is your babies don't cry at birth. And I tell you, within the first 3 minutes, if the brain does not get oxygen, that part of the brain dies. I'm trying to raise draw, you understand?
Yes.
So that part of the brain dies, and that is the part of the brain that will be affected when that baby begins to grow and develop, and eventually your cerebral palsy will set in. Now, a baby is born, the part of the brain that is not oxygenated probably is at the frontal part. Now, this frontal aspect controls movement. Do you understand? So if those places not well oxygenated, when the baby is born, as pediatricians, we call something developmental milestones. There's something we call gross development. There's a time for a baby that is born to hold the neck control. After holding the neck, the next thing is sitting with support.
Okay.
That's when your mommy, hold you, put you down. After that, sitting with that support. In those olden times, I remember by 6 months, you're expected to have been able to sit without support. They'll put on a chair, photo shoot you in those days. They don't call it photo shoot then anyway, but I hope you remember.
Yes.
So after 6 months, about 6 to 7 months, you expect, it's a development. A child to be crawling, By about 8 9 months, you expect that a child will be able to walk, hold on to something and walk. And of course, by a year, you expect a child to be able to walk. But don't forget that this same child did not cry very well at birth, what I call severe perinatal asphyxia. Of course, that child is a candidate for to develop cerebral palsy. So it doesn't just jump on a child. There must have been a process.
The process.
No, so apart from the baby not crying,
Mm.
developing cerebral palsy, jaundice itself also causes cerebral palsy.
Really?
Yes, it's also one of the etiological factors for so it's not just not crying, jaundice, and a baby also that is not fed on time. You deliver a baby, and it is said that within 30 minutes, you understand, rooming in, bonding, you should have given the baby to the mother. But we find out that some mothers, though, yes, there's poor lactation, at times you hear this story for 2 days, they are just giving the baby water. It's not good enough. Some of the brain cells would have died. And of course, you eventually find that the baby does not go through the normal developmental process, developing cerebral palsy. So cerebral palsy itself is an end to whatever happened ab initio.
Thank you so very much. It's still the issues on IKD 106.1 FM. I am learning. I hope you out there, you are also learning, and I hope that you're getting one or two facts from our conversation today. Coming up next, I want us to talk about the steps to take as parents when it has to do with child care. Are there forms of registration to it? Especially when you talk about General Hospital Ikorodu. I like the fact when you said that at your hospital there is a doctor that is assigned to checking all of these newborn babies to be sure that they are jaundice free. Now, when we talk about child care, which is our conversation today, how would a parent go by it when we say childcare? What should the parent do? Does the parent needs to register? The reason for this question is I know there are registrations for antenatal. That is before childbirth. The parent will need to register. The mother will go for some days, some weeks. But when it has to do with childcare, what are the procedures by which one can go by this? If you're listening to us, you can join this conversation on Facebook, where you can watch us live, and be sure of all of these descriptions. My doctor in the studio today has some descriptions that she's giving to us, which would be very nice if you can see this one. So join us on Facebook, IKD 1061 FM. Now, doctor, before we even talk about what stage at which a parent can maybe enroll or register, in clear terms now, I want to go back to the myths, these ideas. Maybe one or two should be fine for the benefit of those that are listening. Some of these things that we do wrongly as parents, as mothers, as fathers, even the grandparents too as well, they have a major role too to play, because most times they are the ones that would say that this is how I did it for you, so you should also do it this way. Can we, in clear terms, mention some of these myths that we are doing wrongly in Nigeria?
Yeah, thank you so much for those questions, because some of this I've already listed. One that I want to talk about is this issue of tongue tie.
Okay.
A lot of mothers bring their babies to the hospital, and in fact, by the time they say, doctor, am I?
Yes, please.
Eba mi wo.
Yes, please, go ahead.
So àwọn ọmọ mi lẹ̀ mọ́lẹ̀. That is, doctor, my baby, let me check, the tongue is tied. Some may say you want to go to another. In fact, once they open their mouth and say it, I know where they're going. And the first question, in fact, such opportunities are opportunities for me to sit them down and give them a little lecture. The first question I ask many of them is, when your baby is crying in the bedroom and you are outside, probably at the backyard washing clothes, do you hear the sound of the baby? And I tell you the truth, about 99% will tell me yes, they hear the sound of their baby's cry. And I said, madam, your baby's tongue is not tied down. Now, the tongue, the way nature has made it is that there's a frenulum. If you raise up your tongue, you see a little flesh attaching it to the roof of your mouth. That's why your tongue is not, jumping up and down. It's normal.
It controls the movement of the tongue.
Exactly. Beautiful. Yes, to some degree, I'll come back to the question.
Yes, please.
To some degree, yes, there could be what we call ankyloglossia. That is medical language for tongue tie.
Okay.
It's not very common. Yes, the tongue actually is almost glued to the floor of the mouth. And in such babies or children that you have such conditions, they find it difficult to eat feed or talk. Yes, but they're not common. Now, going back to that question. So by the time I now take time to tell them, madam, babies don't talk. Though we talk with our mouth, but it's actually our tongues that do the talking. Now, the form, babies don't talk. They can't talk the way I'm talking to you, but their own form of talking now is crying. So by the time you're able to hear the sound of your baby crying, that means the tongue is not tight. So there's no need to cut the tongue. I tell you the truth. By the time I do that, oh, they are happy, they are relieved, they go home. And of course, you understand there was this issue of this unfortunate thing that happened. A baby, of course, a mother, and usually it's people around that tell them your baby's tongue. The baby had a tongue cut at a place I won't mention. The baby was eventually brought to General Hospital Ikorodu. The baby bled, had lost a lot of blood. The baby died. And at times I do give them these examples. So, madam, there's really, for this particular child, it's not applicable. Do you understand? Don't forget the other extreme that I mentioned, but that is very rare. The other one I want to talk about is the care of the umbilical cord.
Exactly. I was thinking you would say that one.
I wrote it down.
Yes.
Care of the umbilical cord. We know that when babies are born, of course, the cord is where the baby is attached to the mother, as to the placenta, in utero. Now, this baby is one fine baby comes out. Now, one of the things we do is that there's this gel that is used in cord care. We call it chlorhexidine gel. Fine. It's a daily application. So mothers wash their hands, apply it once a day. Fine. Eventually, the cord falls off. Or the use of methylated spirit, which is ideal. And we tell mothers if it's methylated spirit that contains 70% alcohol, they clean it as much as 8 times in a day. Fine. And they don't put that cord inside the diaper. So when you put on a diaper for your baby, the cord should actually be out. It should not be enclosed within the diaper. Now, for some babies, after the cord must have fallen off, or probably before, we've seen people, at least I've seen somebody applying close-up toothpaste. It's very, very bad. And, in those olden days too, people also, after the cord must have fallen off, they use a rag, put on top of a lantern, and they try to apply that heat to kind of massage the cords. Is a very wrong practice, because by so doing, some of course develop infections, tonsillitis, reddening of that area, and we've had to admit, 1 or 2 of such babies on the ward rather. So the use of toothpaste, use of lantern with cloth to massage,
that is even
all
very
those
common.
Falling off of the cord is a natural process. It will happen. And of course, we know in some cases you may have a delay. If there is, just bring the babies to the hospital. We know what to do, and your baby will be fine.
Okay, thank you for that one. It is still the issues on IKD 106.1 FM. I would open the phone lines now if you have questions for my guest, Dr. Abiola Ademolu from the Pediatric Department, General Hospital Ikorodu. She has said a lot, and of course, she will still enlighten us more on what next to do. But then I would open the phone lines for questions on 0904 0811061 or 0904 082 1061. Those are the studio lines where you can call and ask questions in line with our conversation. Myths of childcare. Some ideas, some beliefs, some doctrines that we take to heart most oftentimes, especially from this part of the world. Like I made an instance the other time that before we have a child, we have what we call the antenatal.
Yeah.
But in most cases, immediately after delivery, I think what happens most of the time, if I'm not mistaken, is maximum 3 days. The mother and child is still in the hospital. From the day 4 or day 5, they will discharge so that they will go and do naming ceremony, which is the 7th day and all that. We don't often see that children come back to hospitals for care and all that. What should parents do? What are the procedures? Are there something that they call registration process or what? Please, let's talk about that.
Yeah, thank you very much, because I thought you had forgotten.
No.
Yeah. So, as you rightly said, childcare actually begins from the time of pregnancy. And that is, of course, the pregnant women antenatal care, fine.
Exactly.
Now, we take over the management of the babies. And we know that in pediatrics, when babies are born, of course, immunization clinic starts.
Okay.
So, at the immunization clinics, there are specific ages that clinic targets. And by the time they come for the first shot of immunization, they are given dates, appointments, they keep coming back.
Okay.
And at the immunization clinic, it's not just about giving jabs, injections, give vitamin A and all that. There's some degree of health talks to mothers as per, answering their questions, how to take care of your baby, give them another appointment, fine. And there's also what we call the under 5 clinics.
Okay.
Yes, some centers also have what we call the under 5 clinics, the peculiar things to under 5s children, of course, which are not peculiar to newborns. They also discuss their immunization continues, you understand? Of course, talks about diarrhea, what to do, ORS, some basic things. So if mothers avail themselves of those clinics, I tell you, they'll be well enlightened. And of course, they will get some take home messages, packages on how to appropriately care from some common diseases.
Dr. Abiola, what bothers me now is the importance of these steps that you've mentioned, these procedures at which a child care should be done by the parents. Because we have some that are not doing these things, and yet the children are growing. We are seeing them, they are hale and healthy, so to say. So please tell us, as a doctor, how important are all of these things that you mentioned? There's this particular injection that they also give to children at the early stage. We see these people walk around the street, they give this injection. We still hear that some parents will tell you, we missed it, but the child is still okay. So tell us, how important are all of these things to a child?
Yeah. I want to start by saying the NIDs, that's the National Immunization Days, those vaccines that the government, NIDs,
yes.
they take around, you understand, does not obliterate or cancel the laid down ones that mothers should bring their babies to the hospital for. I hope you understand.
Okay.
It does not negate or eliminate that. That one is there to stay. But these are additions. One complements the other. It's not a substitute. The fact that I'm taking the ones they are coming to my home, one ball, does not. It's not a substitute for the ones in the hospital. They are, they go pari passu, they complement each other. Yeah, fine. You said some children, they may not really do this, and yet they're already fine. You don't underestimate the power or the place of good nutrition in children. I hope you know that. You don't underestimate the place of good nutrition, because good nutrition actually plays a vital role in the cognition, that's brain development of children. Do you understand? If children are well fed, and of course the mothers do all they can to comply to the routine immunization, they'll do well.
We'll come back to General Hospital Ikorodu, and we want to know in clear terms how it works over there. You mentioned the part that there is a doctor that is assigned to monitoring. Then we also want to know some things for the benefit of our parents out there. But just a little bit out of the conversation, this is something that is bordering or another form of myths, where they will tell you that a pregnant woman must always eat banana, that it helps in building the child and all of that. But even aside that one, we have another form of myth where they will tell you that, okay, when the child grows up, the child, aside breastfeeding, while the child is growing, that there are some gymnastics. Just like the video you mentioned, not gymnastics, there are some exercises a child should do and all of that. For a baby that is growing, can we talk about these ones before we go ahead, please?
Babies do not need any additional exercise. What exercise do you want to give a 6-month-old? You understand? Now, babies have some, what we call some so-called, I don't want to use the word abnormal, when you lie baby, that baby is not sleeping, you see the baby doing the hands and legs,
the body movements and all.
That's enough exercise itself. And of course, there's a medical reason for this. Do you understand? Of course, you don't expect a 3-year-old, 4-year-old to sit down and be throwing his legs up and down. You know that there is you understand? So the mere fact that a baby, babies don't actually need exercise. And of course, by the time they start crawling around the house, moving, that's So they don't need a special form of exercise.
Mm.
You understand? You understand, for them to develop.
Mm. Okay, so thank you for that one. Now I want us to, before I will let you go, I think we still have about less than 10 minutes. I want to especially say thank you for giving us the time to have this conversation. Now, talking about childcare, this last one before we ask for your advice. Let's talk about parents now, in particular, the fathers. What role do you think they have to play, especially when it has to do with childcare? Most oftentimes, we see that when you talk about childcare or you have a thing to do with childcare, it has to be just mothers all the time. Even when you talk about antenatal, for instance, you see the mothers most of the time in the hospital and the fathers are not there. What are the roles you think a father can also play in helping when it has to do with childcare?
Yeah, thanks for that question. I think basically the father's role is, I would say, twofold,
Okay.
in the area of finance and in the area of support.
Mm.
If a woman has a supportive husband, I tell you, the woman will be happy to come for antenatal,
Mm.
happy, to look after her own health and that of course, the baby or babies or children.
Mm.
You understand? But in some homes, father not supportive,
Mm.
not putting down money for antenatal investigations, tests, of course, the woman will not be happy. So, father's supportive role, financial role, goes a long way in determining the outcome of some of these um, um,
The
problems.
children.
Yes.
Now. Before we go from our 10 minutes, is it okay for you to at least tell us some more, if possible, one more of this meat? Because I'm more interested with this meat. It has become the order of the day. Can you just tell us some more that you know of, that you have experienced?
Yeah, thank you very much for that question. The last thing I would think I want to talk about is the use of palm oil in babies who aspirate.
Palm
Now,
oil.
palm oil, yes, we found that especially on the fives and male toddlers, who have started moving about. We have instances they bring them to the hospital. Those one went to drink soap.
Hmm.
Those one went to drink kerosene,
Hmm.
and things like that. And of course, the reason is not far fetched. The liquid soap, they're colored. Kerosene
So it
looks
looks
like,
attractive.
exactly. So they're kept in containers. It's so easy for those kids to go and And the first thing most mothers do is, of course, not just the mothers, neighbors around. Oh yeah, yeah, epo, palm oil.
Exactly.
They give those children. Though yes, they have good motives. They don't come with the intention to harm or cause further harm. But we find that in practice, such practices lead to further harm than the liquid that the child actually took. Because we find that in the process of giving the child palm oil, the child will want to vomit. It's a natural thing. You give the child palm oil, nausea sets in, and the next thing, wow, the child vomits. And in the process of vomiting, the child aspirates, ogbepari, and you see them, omami gule gule, they get to the hospital. So please, when children take all these poisons accidentally, the first thing is not to give palm oil. Do you understand?
Okay.
Yes. The first thing, loosen all tight clothing and all that, and quickly rush the baby or children down to the hospital. Please, let's stop the use of applying palm oil each time. It causes more harm than good.
Because that happens a lot too. The first thing they think of is just go and get palm oil. Just get palm oil. So now let's talk about this particular set of people, which will be the last one. Thank you very much for your time. Now, the older generations. When I say the older generation, I mean our grandparents, of which you also fall to that category. So now it's like you're going to be speaking to yourself too as well. Our grandparents are most of the times, I don't want to say problem or reasons to why the children do some things when we talk about mates, because they will clearly tell you that was how I raised you. What do you have to say to grandparents, parents that are out there bringing back all of these ideas, methodologies that are archaic? What do you have to say to that?
Yeah, thanks for the question. I want to first of all start by saying thank you to our mommies, our daddies, our grandmas and grandpas. Without them, you and I may not be where we are today.
Definitely.
Remember those olden times, mothers, fathers, they have to go to work and they are there for us. Years, months, we thank them for their good work towards us. Now, that question, it may require some wisdom because in most cases, it's usually the father's mother in this Yoruba part that comes to stay.
Exactly.
Unlike the Igbo culture that is the mother of the bride that comes to do omugo. So it's easier for the lady to tell the mommy, no, 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 my husband, we've agreed. Okay, sorry, I have a colleague, both of them are doctors, and of course the grandma stays with them. I remember she said, you are talk where,
I leave you to your thing.
some laugh it off and it dies and goes, but of course I know it may cause some offense to some other people. So that's why I say actually requires wisdom on the part of the mother. Something is harmful to your child and probably your mother-in-law wants to do it. It's a matter of mama. It depends on the way you approach mama. Pẹ̀lẹ́, ó lákọ, ó lábo. It depends on the way you approach mama. If you're able to carry my mama along, talk to her nicely, politely as a daughter, she will understand.
So the approach actually matters a lot.
Yeah.
You've done well to do all of this analysis, explanations. Your parting words to every parent out there. And at the same time, I want to do a 2-in-1 question. At the same time, General Hospital Ikorodu, let's know your availability when it comes to child care. We know of the antenatal. We have had some of your doctors who will come and say there are these particular times and these particular times. So let us know when you talk about child care too. What are the measures that are put in place by General Hospital Ikorodu? And then your parting words to every parent out there.
Yeah, thank you so much. General Hospital Ikorodu, I'm from pediatrics department. So as I said, babies are born, immunization days are there. They come for their immunization as at when due, and of course they are given further appointments to complete the immunizations. And of course we also run what we call the outpatient department or clinics. Babies or children can be brought to the hospitals anytime they are ill.
Okay.
For proper management tests, investigations, and of course for medications and treatment if need be. And of course the emergency section is open 24 hours for critically ill children or babies, and of course babies that will require admissions. So the 3 arms of the practice is available for parents to make or avail themselves of. So my parting word to mothers is that knowledge is power. If you know something, it's to your own advantage and you use it to bring up your own child and baby and nurture him or her through childhood. Know the right things. We've explained a little here, and of course times are good now. We have Google. You can I think there's an application there that talks about pregnant mothers, and I'm sure this olden book in those days where there's no doctor, all those things, avail yourself of. Know which is good, know your limits, and know when to bring your babies for proper investigation and care. Thank you.
Thank you so very much, Dr. Abiola Ademolo. It was nice having you on the issues today with that proper enlightenment that you've given to us on needs of child care. Special thanks to your department as well, the Pediatric Department, General Hospital Ikorodu, and special thanks to the management and staff. I hope you are not missing Dr. Femi too much because I get yes, I get that he's now with Agboa. But maybe we should take one call if possible. I see we have little time. Hello.
Good morning.
Yes, good morning. Your name and where you're calling us from?
My name is Friday.
Okay, Friday calling from where?
From Ikorodu, yeah.
Okay, our time is fast spent. Can you just talk to us briefly in 1 minute?
I know.
Okay.
I want to appreciate the woman there.
Thank you.
But she fast in her explanation.
She's fast in her explanation.
Yeah, yeah. So
Okay.
she will talk something about umbilical cord.
Okay.
And then they should cut it. Probably they use
Paste.
that thing on that just to cure that thing.
Okay.
So, going to cut it. Is it not that the hospital that they are going to cut the hospital?
Okay.
And the other one, the last one is there is oil that they put on those children, those little baby head.
Mm.
So, and that always chicken like. So what that oil is meant for?
Okay, thank you very much. We've taken that down. Thank you. Doctor, can we do justice to that in a few seconds?
In a few seconds.
Yes.
Mr. Friday, thanks for your comment. Now, the first thing is the cord, yes, is cut usually after the baby is born. So I was not referring to when the cord is being cut. I was referring to when the cord has dropped. So some of the practices mothers do, or grannies and all that, they're applying toothpaste to the cord or using hot rag or lantern. That's what they do after the cord must have fallen off, which I said is a bad practice. Now, that oil they put on the anterior fontanelle, some use eucalyptus oil, some use baby oil. It is not necessary. You understand? It does not do anything. It doesn't do anything to that place. It doesn't close the place. It doesn't open it up. So it does not do anything to the place.
I hope your question has been well attended to our caller there. This is how far we can have it today on the issue. Special thanks to everyone that was part of this. Special thanks to those of you on Facebook too. We see you from that end. And of course, we send our regards to you too as well. The issues continue same time, same station tomorrow with a Gift Obuna. My name is Opeyemi Adebambo. It's a bye for now.